What is the first thing you think of when you hear the word hospital? Is it the doctors, the nurses, the healthcare that hospitals provide to patients in need? What you might not consider is that the healthcare sector accounts for 6 to 8% of the greenhouse gas emissions in the US. To reach a sustainable society, the healthcare system will need to work on reducing these emissions. However, there isn't a universal framework or tool to aid hospitals in their sustainability efforts and to implement changes. Thus, my research aims to look at the sustainability efforts within the healthcare system. This leads me to my research question: what are the challenges and opportunities to implementing sustainability changes in hospitals? To do this, I interned at Harborview Medical Center, where I interviewed employees and contractors to learn more about the sustainability efforts of the hospital. I also filled out the 2024 Practice Green Health application, which covers the metrics in Figure 1. Practice Green Health is an organization helping member hospitals make sustainability changes by providing tools, resources, and solutions. More on that later. Finally, I completed a literature review looking at sustainability efforts in hospitals. Now, let's go ahead and take a look at some of the opportunities that hospitals have to implementing sustainability changes. First, starting is easy. Hospitals can start making sustainability changes just by tracking and measuring data alone. This can be things like how much of a certain product is purchased compared to how much is actually used. If you're purchasing more than you're using, then that is an easy way to see where you and your hospital can lower your costs and possibly even lower your environmental impact. One example we'll get to later, but now another example of an opportunity is the UPass membership, which was extended to all UW Medicine employees, which resulted in a 10% decrease of single occupancy commute trips. Lowering this is significant in that less people that are driving cars is less greenhouse gases emitted from those cars. And finally, another opportunity is with the help of Practice Green Health, Harborview is working on implementing the solution from Figure 2 to reduce any unnecessary emissions and costs from the use of nitrous oxide as an anesthetic gas. As we can see from Figure 2, using a central supply where the nitrous oxide runs through the piping system of the hospital and is spread out into the rooms and used when necessary. Instead of using that system, switching to a portable supply where you are carrying a canister or taking a canister and bringing it to each room when needed reduces the amount of emissions from 594 megatons of CO2 equivalent to 5.6 megatons of CO2 equivalent annually. And Harborview is also, again, like I said, working on implementing this change as well. Now, let's look at some challenges. First, hospitals need everyone to buy into the sustainability efforts, and this needs to be driven by leadership. There's also a lack of resources to implement sustainability changes, whether this be money or knowledge and tools. And finally, hospitals need to future-proof in areas like transportation, energy, and with the buildings that they use. For example, with transportation, switching reliance on only single occupancy vehicles like cars or trucks to being more accessible for other forms of transportation like public transport, biking, and even walking can help future-proof the hospital. Now, to the significance and implications. Hospitals should have a sustainability-focused employee if they don't already. Again, like I said earlier, tracking data can help hospitals start to make sustainability changes and save money. Using a sustainability framework like Practice Green Health can further help by including data sections that hospitals might not have considered before, and can also increase the effort that a hospital is putting in. Frameworks can also provide benchmarking, so hospitals can see where they are compared to other hospitals and find out which areas they need to be focusing on in order to make changes. And finally, to make those changes, sustainability frameworks like Practice Green Health give hospitals resources and information to aid in reaching their sustainability goals. Like in the case of Figure 2, Harborview is able to start implementing the solution to a portable supply of nitrous oxide from a central supply, thanks to Practice Green Health sharing these results from Providence St. Vincent Hospital. I'd like to go ahead and thank my site supervisor, my faculty advisor, the Capstone cohort, my family and friends for all the help that they've given me throughout this entire process. Thank you.